KYKS, good morning. It is the Merrell in the Morning Show. It's been a year already. A year has passed since we have last done this with our friends from St. Luke's Health Memorial in Lufkin. It's it's Heart Month, and this is a time that we use this day where we kind of take over the morning show to, shed some light on education, on what's available for you here in the East Texas area to live a better heart, healthier lifestyle. And with that being said, the theme for this year is you depend on your heart, so take care of it. St. Luke's Health Memorial can help. And this gentleman has been a guest on the show now numerous times over the past few years. It is wonderful to have him in once again, Dr. Ravinder Bachireddy, and who is the Chief of Cardiology at St. Luke's Health Memorial, ACC cardiovascular champion, founder, Heart Institute of East Texas. I mean, the list could go on and on and on. And it's a pleasure to have you here once again, sir. Thank you so much for coming in.
Thank you. It's a pleasure to be here.
We're going to go through some of the questions that we have here, but one of the things that you said when you first walked in here is deserving of getting the word out there, because I know there's many accreditations that we've talked about through the years that you get. And this one that just most recently came down is like one of two in only the state of Texas, 11 in the nation that you've gotten. So let's talk about that, if you don't mind, just to lead things off.
Sure. Let me talk about this award that we recently received. It's a recognition from the American College of Cardiology, the prestigious institution in the country, has recognized Heart Institute of East Texas as one of the only two accredited heart failure clinics in the state of Texas, and one of the 11 in the country, in the United States. I think we are extremely happy to have been recognized as such. The reason this is extremely important is heart failure is chronic, debilitating disease affecting millions of people in this country. More than 6 million people live with heart failure in this country. The significance is 1 out of every 6 people in this country will end up having heart failure before they die. Mm-hmm. A sudden death is very common in heart failure patients, and the readmission rate to the hospitals and the suffering it causes is immeasurable. That's why this is significant to have been recognized as heart failure clinic of noteworthy institution. The reason this is important is the recognition is offered only to those institutions who follow the guidelines of American College of Cardiology and follow with a multidisciplinary approach, improve the heart care patients with heart failure, not only help them to recover from heart failure, but help them not to be readmitted to the hospital again. And this is a great achievement. And we are all happy. And this could not have happened without the complete and continuous coordination and teamwork of all the cardiologists of Heart Institute of East Texas and with the healthcare professionals, not only at the Heart Institute of East Texas, but also the hospital, because it is a continuity of care. Patients getting admitted to the hospital, the transition of care from the hospital to home, and then to the clinic, like Heart Institute of East Texas.
And with that being said, this is just one of many honors, many accreditations that has been received by the Heart Institute of East Texas through the years. And so, I mean, especially for you, this must be yet again another proud moment for you personally, because, I mean, let's go back 40 years now, because you just now celebrated the 40th anniversary. Let's go back 40 years and talk about what your vision was when you co-founded this with Dr. J.S. Chandra, and what your vision was for the Heart Institute of East Texas.
Well, when I first came to Lufkin almost 40 years ago, I was shocked to know that there was no cardiac care available to this part of East Texas at the time. Most of the patients who have had heart conditions like heart attacks, heart failure, or strokes were traveling to Houston or Dallas all the way, or being transferred from the local hospitals to Houston and Dallas and other major metropolitan cities. So I decided at the time that we should have, and my vision was to build a heart program that will take care of patients with all kinds of heart problems, including coronary artery disease, heart failure, valvular heart disease, and cardiac dysrhythmias.
And so how did you, because that's a huge vision, to get from where that was 40 years ago, even for the first year or two after that, what's kind of the foundation that you started that off with? I mean, did you reach out to some of your colleagues that you knew, or what?
The first thing I did is convince the local physicians who have been my friends for many, many years that it's extremely important for us to have a heart program which is excellent to serve this part of the East Texas, to bring latest of the technologies to this region. And they were all convinced and helped me, along with the hospitals, administrators of both the hospitals. We built a cardiovascular program, again with teamwork and the physicians coming together. Invited Dr. Ross Kiger, CV surgeon who was practicing at the time with Denton Cooley, to come to Lufkin. And he did come to Lufkin and build an excellent cardiovascular program along with us. And then several innovative procedures were brought to this region, including angioplasty, stenting, atherectomy, rotobladder technology. So we have trying to become a regional medical center of excellence to serve the East Texas community.
And so how does having all this technology and all these treatments and these cardiologists and specialists, how does this treatment closer to home factor into a heart patient's outcomes and recovery?
I think the most important thing was the patients didn't have to go all the way to Houston.
Right.
It put a tremendous burden on the families, the loved ones, to take these patients to Houston. Once we brought these technologies back here at home, they didn't have to transfer all the way to Houston. The second thing that happened was when you have a heart attack, it's sudden. It's devastating. Time is muscle. Every minute you wait for to get the treatment, muscle is dying. Nothing can be done after 4 to 6 hours. Now, with all the technologies available, we can treat the patient quickly and send them home quickly. And that will help not only the patient go back to return to work immediately, but also help the families of this burden of significant time invested in it, as well as a lot of money involved. Take care of the patients.
So we are now here at the 10-year anniversary that the Heart Institute of East Texas formed a partnership with St. Luke's Health Memorial in Lufkin. How did that partnership come about?
I think we all know that East Texas has the highest incidence of cardiovascular diseases in the state of Texas. The most important reason for that is lifestyle. The patients or the people in this region, they love to eat. Inactivity is their activity. They don't do much. And these bad health habits contributed to the high incidence of cardiovascular diseases. The smoking was rampant at that time. So in 2013, Gary Looper, then the CEO of CHI St. Luke's Memorial, and Heart Institute of Cardiologists came together to do something better for cardiovascular care, not only in Lufkin, but the surrounding communities. So we then formed a partnership. The partnership is meant to deliver high quality, cost-effective care to improve the quality of life for the East Texans. It also involved bringing the latest technologies, building the facilities, including subspecialty clinics, and improving the processes, efficiencies in the processes. All these things were involved. In addition, the central focus of all this is patient education. And since then onwards, Heart Institute cardiologists have been giving educational meetings, educating the patients, the families and the communities in East Texas region, not only in Lufkin, Angelina County, but the surrounding 10 counties. We have given almost 100 lectures every year. And the Heart Month alone, we have given educational seminars about risk factors and how to prevent cardiovascular diseases, ranging from 25 to 30 educational meetings in just 1 month, Heart Month.
As you've mentioned, through the 40 years that you've been there with the Heart Institute of East Texas, obviously adaptations and changes and modernization of technology that is there has certainly helped to treat. But as you mentioned, education is key. In the 40 years, what more can be done to bring that education to Lufkin and outlying areas? And what sort of changes, if any, have you seen as far as just a general scope, I guess, of the public and, buying into eating healthier or exercising more or smoking less?
I think that's the most difficult task, especially the mindset of some of the people in East Texas. It's age-old habits, hard to break.
Sure.
So lifestyle changes are extremely hard. But then I'm optimistic, and we have to be optimistic. We have to approach this problem in a stage-wise manner. The first thing to do is educating the people about the risk factors and the consequences of not taking care of themselves, not following the heart-healthy diet, not doing the regular exercise, not taking the medications. Which also means if they don't follow these, they can end up having heart attacks, strokes, and have detrimental consequences. And that's why it's important. Understanding the risk factors, I could see majority of the patients change their health habits. I've seen many patients who have come to these meetings have stopped smoking, they have started on healthy diet, and they have also started exercising regularly. So it's an ongoing process. The education has to be regular, continuous, because you have to engage patient by patient. You have to engage the communities, and you have to engage the families, because it has to be done, all of us together.
You touched a little bit upon the team building that you have done through the years. Let's kind of go back and talk a little bit more about that, because you've managed through the years to put together a team that offers a variety of great services all under the same roof and basically share a common vision. Can you talk about that team building through the years?
You rightfully said, for a common goal and to achieve a vision, team building is extremely important. And it's done step by step. It is done with true leadership. It is done with trust, bringing people together. It involves creativity, a culture that you create, and then you have to bring the like-minded people with commitment who understand the importance of collaboration and working together. And that will lead to success. And that's what happened in our case when we first started building the Heart Institute of East Texas. I was the first cardiologist in town. Then Dr. Chandra joined me 2.5 years later, and we worked together and had the cath lab first, bringing all the physicians together. Then we had the open heart surgery program, again with the help of all the local physicians. So it's all team building of the leadership, team building of the physicians. So everything starts there. And there is a role for everyone in cardiovascular diseases, if you want to prevent it or if you want to treat it.
Right. We've also touched a little bit upon the partnership with St. Luke's Health. What are some of the advantages of a partnership with a healthcare system such as St. Luke's Health?
I think the partnerships are really pretty significant and many. You cannot do everything alone. You have to do it together. Mm-hmm. So you have to include everyone. I think the biggest partner we have is the hospitals in this region. So when Gary Looper, the CEO, approached me about this problem, and we sat together and tried to deal with this biggest problem in the country and biggest problem in East Texas. We wanted to work together, and that's what we did. So the results of this is we could create access to all the counties surrounding Lufkin, where there was no cardiovascular services available of any significance. The second thing that happened was we could not only give access, but give educational meetings and treat these patients in the earlier stages of cardiovascular diseases, though it won't progress. And the other advantage of this is, because of what we did, we were recognized as the best small business of the year, both by the Angelina County and the state. Because of this, we were recognized by American College of Cardiology as the Heart Care Center of Excellence, because of what we did in terms of giving access, improving the quality, appropriate and cost-effective care, not only in Lufkin and Angelina County, but surrounding 10 counties.
There has been a name of a patient that's been brought up several times during the interviews that we are doing today, and that name is Valianne Kerr. And it seems to put a smile on everybody's face when we mention her name. Can you shed some light on what she has done for, or what her case means for the future of heart care in East Texas?
I think it's wonderful that you brought that person's name.
Uh-huh.
This lady is amazing, and she has gone through a lot in the last few years, and we could give her a hope for her so that she could have heart transplant. And Dr. Saini, my associate, worked along with us and made sure she could sustain because of her debilitating heart condition, including malignant arrhythmia. And then patient had a heart transplant and came back and is doing extremely well. The reason this is important is this is the team effort again. Everyone working together, make it happen before, during, and after. She came back and went through the cardiac rehabilitation program, which is the best in the country. Only nationally accredited cardiac rehab program from Tyler to Houston. The another interesting thing that I noted is, I hope it's the same person because there are not that many people with that name. About 10 years ago, she did a Good Samaritan type of help to the local community.
Uh-huh.
I think someone who did not have, lost a leg and had an artificial leg, was trying to stock something into the van, take it to Houston. So she was worried, how is he going to, people helped him to pack things into the van and he was taking it to Houston. Who is going to bring it down, right?
Right.
So by the time he went, there was arrangements made that someone was there ready for him to unpack all those things and take it to the place that it gone. And that was done by her apparently.
You arranged that, huh?
Yeah, which I just read it, recently that happened. So this kind of a Good Samaritan work, this is what we call humanity. As human beings, we should have that. And helping others enriches us more than ourselves. And I think that's extremely important. And the key for all this is you not only take care of your lives, because that's very important so that you can help others, but also take care of your loved ones, take care of your neighbors, take care of your communities, because the health of the community depends what determines the economy of the community.
Very well said. Very well said. Anything else you'd like to mention, Doctor?
Yes, I want to say that the future is bright for Lufkin, for Angelina County, and the surrounding 10 counties, because we have a strong foundation. We have built a great team. We have built a great partnership from the Heart Institute with both the local hospitals. And we built partnerships with the Heart Institute and the communities through the education. And we have be in the Heart Care Center of Excellence. And we also received the Pioneer Award for being the one of the first 10 hospitals to receive Heart Care Center of Excellence. And this recognition, hard work, dedication of the heart team exemplifies innovative forward thinking of all the people, both the hospitals, and all the cardiologists of Heart Institute of East Texas. I'm especially proud of Heart Institute of East Texas because all the 12 of my colleagues are board certified, and they are so committed in taking care of the patients. And they have the skills that are only available in best of the institutions, in big centers like Houston and Dallas. And I think we have to, together as the physicians, hospitals, and the communities, work towards building healthy communities. That can only happen if everyone has a role to play and everyone understands that he has an extremely important role to play.
Dr. Bachireddy with the Heart Institute of East Texas, thank you for your vision. Thank you for your leadership, and thanks to you and your team for giving so many people in East Texas hope.
Well, thank you very much, Danny. I think this is a good message for everyone that we should work together.